Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. Friends, as you know, we were discussing about Graha Rogas and we have taken more than 5 classes regarding the same, and to some extent we are able to compare these Grahas with the present day concept of microbiology and microorganisms. Now we shall see what is the root cause for these grahas. What is the root cause? Why these grahas are there in the earth? In other words, to say, why these microorganisms are there in the earth. So, how they will going to affect the human beings, and what is their motto, and what is their role in maintaining this universe. So, all such factors we will discuss today's class. Now, grahas are different and graha rogas are different. Graha roga means it is caused by the grahas when they are vitiated or when they get angry or when they cross their physiological limit, when they become pathological. The grahas will go into cause graha rogas. Otherwise, grahas will remain as grahas and they are not much harmful to the mankind or any of the living organisms. Now it is told that a graha becomes graha roga. A graha, which is basically physiological, I will explain that, now become pathological. The factor which is responsible for that is adharma. If an individual is following adharma, then that becomes the root cause of different disorders. Similarly, it is also the root cause of graha rogas also. Now the question comes, what do you mean by adharma? Adharma is nothing, dharma, adharma, this is nothing to do with in religion and all. Adharma means not following the right way of living. Now we have got a code of conduct for the living. How should be our lifestyle? How should be our activity? So what we have to do in the morning hours? What we have to do in the evening hours? What is the bedtime? What is the awakening time? What is the meal time? What we have to take in the meal? While taking the meal, which particular rules and regulation we have to follow? Everything has been written in the Ayurveda. And how we have to change ourselves according to the day and night and according to the season. And how we have to maintain our psychological backup or psychological stability. So everything has been very clearly mentioned in the Indian philosophy and also in Ayurveda. So wrong way of living itself is called as adharma. And when an individual follows the wrong way of living, that even causes the graha rogas. Okay. Now physical, psychological, spiritual, social health will be afflicted. Now, when you are following the adharma, your physical health, your psychological health, spiritual health, social health, everything has been get affected. Okay, so few of the examples are just not following the Svastavrata, not following the Sadvrata, not following the Dinacharya, Rutucharya, Achar Rasana, or doing any work which is against the nature, or not maintaining the personal hygiene, or doing Dashavida Papas. Okay, and so these are some of the activities or some of the facts which leads to adharma. Adharma, when you are following, it creates a loopholes in the body and it makes the body more vulnerable for the graha roga. So when you follow the adharma, directly or indirectly, so what is get affected is the integrity of the body is get affected. That means I can say the 3 basic elements of the body, vata, pitta, kapha, so they undergo fluctuation, and as a result, so there will be some asama or the samanata which is present. Okay, some samanata or equilibrium which is present in the body, that will get disturbed, and once it is get disturbed, we know that the roga prashama and the roga utpatti, that is because of the variation in the vata pitta kapha. Now here also, when you continuously follow the adharma, adharma may be sometimes very strong, adharma extent may be sometimes very less, but whatever, the based on the extent and its power. Now adharma creates so many problems in our body. Okay, so it gets a loopholes in the body. Nothing but, this means nothing but ki your body immune system is badly affected. Either your immune system is suppressed, or it is overexcited, or it is confused. Okay, if it is suppressed, it leads to immunodeficiency status. If it is overexcited, it leads to so many autoimmune causes of the disorders. And if it is anyway dull, it leads to so many other infections. So same is also true for the microorganisms. See, microorganisms are there in this universe, Our number, human number or animal number, is negligible in compared to the microorganisms. So in a single room, there's a thousand, lakhs or crores of microorganisms are there. But these microorganisms are not able to enter inside our body because our immunity is good. Once our immunity falls, definitely they are going to enter, because after all they are in search of host, nothing else. So they are always in search of host, so definitely they can enter into our body. So it is our responsibility to maintain the body immunity, okay, by following the dharma, right way of living. When this is affected, and that itself is the cause for the disease, and also it is a cause for the graha rogas. Now, graha rogas are different from other disorders. Okay, adharma causes many disorders. Even Janapada Dhamsa Roga also, it is told as adharma. And in so many other systemic disorders also, it is told that adharma is the root cause. Now, the graha rogas are a little bit different from other general disorders which we face in the daily routine practice. Okay, so they are separate from the other general disorders because a cause is invisible and unidentified. If I am talking about Mrut Bhakshana Janya Pandu, we know the cause. Mrut Bhakshana itself is the cause. Okay, but in case of, if I say graha, if I say jwara, so jwara, I know the cause. Okay, so we are taking vata prakopahara, pitta prakopahara, kapha prakopahara, something like that. I know the cause. But grahas are not like that. A normal patient will get afflicted by the grahas, and what is causing this particular jwara, this particular graha, is invisible. So this is how it is different from other general disorders. Another is the dosha vitiation is not seen here. See, dosha vitiation is not appreciated. Maybe there is achaya dosha prakopa. Very fastly the dosha prakopa sanchaya etc. is taking place. Therefore, it is not visible by the naked eye. Only after the presentation of the first symptom, we come to know that yes, grahas are entered inside the body and we are badly affected. Okay. Another important thing is mortality rate is very high compared to any of the other disorders. In case of graha rogas, always morbidity and mortality both are very high, and they are most of the time the deadly disorders, and the onset is not identified priorly, and the manifestations are very fastly progressive, severe, and also leads to so many complications. So therefore, the graha rogas, in other words to say, the microorganisms, so when they afflict our body, this is something different from the other disorders like raktapitta or jwara, gulma, prameha, etc. Because these are fastly progressive disorders, and we have to intervene very fastly. Now I have to make clear about some of the facts, because see, when we talk about graha rogas, in association with the graha rogas, so many other terms are also we are getting in the classics. For example, bhuta, preta, pishacha, graha, etc. So jataharani. So these are some of the terms which are used. Rakshasa, asura. Now Vagbhata very clearly explains in the Uttarasthana, he Bhuta Pratisheda Dhyaya very clearly explained what do you mean by bhuta, what do you mean by preta, what do you mean by pishacha, what do you mean by rakshasa, asura, etc. Now Tesha api koti parivaraha. This is what Vagbhata says. That means there are koti parivaraha, crores of microorganisms like bhuta, etc. So while explaining bhuta and preta, he says bhuta, preta, rakshasa. So koti parivaraha, aparimita sankhya. So their number is an infinite number, and they are present everywhere, and you cannot remove this bhuta, preta, pishacha, graha, etc. from this universe. Okay, because they are the one which are actually maintaining this universe. Now we have to understand what do you mean by bhuta, preta, pishacha, graha, etc. Now, by taking the reference of Vagbhata, it's very clear that these are again the invisible living organisms, invisible living microscopic organisms. They may be bacteria, they may be virus, they may be fungus, they may be parasites or anything. They are invisible living organisms which are having antigenic property, Now we have to clear that concept of host and habitat. Okay, now host and habitat is there. See, now a microorganisms will be dormantly present in the nature most of the time because it is not getting the host. Once that microorganisms enter inside the host, then actually it started functioning, multiplication in number and all those things. Okay, therefore always the thirst of a microorganism is it has to find a host. So many of the bacteria, virus, they will going to die when they do not get the host in time. Otherwise, see a poliovirus is there. Okay, poliovirus, when it is passed through the stool outside, and it is mixed with the stool. If you are going for open defecation, it is mixed with the soil. Okay, in the soil, poliovirus is there. Now, the poliovirus which is there in the soil, if it find a suitable host in the right time, then it enters into that host body and cause the problem. Suppose if it didn't find any host, so it will be there only and maybe remain dormant for some time, later get destroyed. So similarly, some of the bacteria and virus, so they will be having more affinity. That means some of them may tolerate the extreme cold, some of them may tolerate extreme hot. Okay, so such rare bacteria or microorganisms are also there. Now, what I mean to say is they have to find a host, and that is their main aim. So they are always trying to attack the host. Animal, birds, human beings, we are all host for them. Okay, so that is a basic nature. So when we see Preta, Bhuta, Pishacha, Rakshasa, Asura, etc., as explained by Kashyapa, so if you look into them, so he says that in the context of Bhuta Pratisheda, he says that okay, in the context of Bhuta Pratisheda, he said this Rakshasa and as well as Asuras and Bhuta, so they are loving the Rakta, Mamsa, Meda and Vasa. They always want to reside in the Rakta, Mamsa, Meda, Vasa. Okay, that means that wherever Rakta, Mamsa, Meda, Vasa is available, they will go and attack there because that is their host and habitat relationship. So this, first we go with the Preta. In the Preta, in the derivation, if you see, Pretaha Punarutpatti Bhava, that means they says that Preta is that particular entity which is present in the universe, which is desperately want to reproduce. Okay, that means Punarutpatti Bhava. So desperately want to reproduce. For the purpose of reproduction, it requires a host. Okay, so most of the microorganisms, they require the host for their reproduction or recreation. Okay, so such entities are called as Preta. Again, this is nothing but the microorganisms in the present context. Similarly, Bhuta. For the Bhuta, he says Bhuta is the one which is very Bhayankara, terrible, Amanusha. The word used is Amanusha, and it always wants Rakta, Mamsa, Meda, and Vasa for its existence. This is again the host means whenever which is come inside the body, it always be there in the area where there is a high blood supply or a high nutrient supply, etc. So it is also true. This is also nothing but the microorganism. Pishacha, Bhuta and Pishacha are included under the same category. Rakshasa. The word Rakshasa means from which we have to do our own Raksha. That is called as Rakshasa. That means we have got a concept of Rakshogna Homa also. Rakshogna Homa, we use so many drugs like Jatamamsi, Sarpagandha, Tagara, etc. Many drugs are there, Gugulu. So these are the drugs which have a strong aromatic smell and drive away the Rakshasa. So from which we have to protect ourselves. That is called as Rakshasa. Okay. So again, Rakshasa is also nothing but invisible. Okay, invisible, living, and it is very, very terrible. Again, this fulfills the concept of microorganisms. Now, Jata Harini, if you look into the Jata Harini, that also affects the human beings only, but age is very specific. Most of the time, pregnant ladies, intrauterine, so many intrauterine infections, pregnant ladies, adolescent girl, or after birth, the purpurar lady, etc. So they will go into effect. Again, they also comes under the same category. And grahas, we have seen, we already proved that grahas, how they can be compared with the microorganisms. So what I mean to say is, the Bhuta, Preta, Pishacha, Rakshasa, then all these things which is explained in our classics, so they are nothing but the facts, they are the subject of microbiology. Invisible microorganisms. Different names have been given depending upon their severity and depending on their presentations. Okay, so they are nothing but, they are not Bhuta, Preta, Pishacha, Grahasa, they are nothing but, so they are the invisible microscopic substances which are present in the nature. That is presently a living microscopic substance which is present in the nature. It is nothing but Graha or Bhuta, Preta, etc. That is nothing but microorganisms.